6 hours, I would say, is rather fast for a procedure of this size, and you want it to look natural enough where people don't really notice, rather than something being so low and so obvious that he had surgery that that's not a mark of success. In this video, I'll be reacting to Everyday Holidays video on hair transplant after 18 months. All right, this guy had some hairline lowering. Look at this. Brought him down by like at least almost 2 inches, or maybe 1.5 inches.
I've been thinking for years about having a hair transplant, but I never was serious about it, mostly because of the price and the pain involved in this procedure.
Well, pricing, Turkey is very affordable, as are places like Mexico. There's going to be, for most people, a price out there that they can probably afford somewhere in the world. And then the other thing he said was pain. Typically, it's not a very painful recovery at all. When all is said and done, most patients don't really say that, oh, they had a very painful experience after hair transplant surgery, at least in the way we do things in my clinic, but also in many places around the world.
Had chosen the Sapphire FUE procedure, and the doctor explained the types of anesthesia that could.
Sapphire blades are just a type of a blade that's used to make the recipient sites for FUE. Most places just have a certain, style of blade that they like to use, which is fine. And most patients are not necessarily choosing Sapphire FUE. They're choosing maybe to have an FUE procedure versus an FUT procedure, but what blade exactly the surgeon is using is typically up to that surgeon. You're not going to tell your barber to use a specific scissor, most likely, so same goes for surgery.
Be used. I opted for the classic anesthesia and did not regret it afterwards.
Again, he makes it sound like it's like an a la carte, selection here, like he opted for the classic anesthesia. I mean, unless they're potentially putting him to sleep as an option, but most places will primarily do local anesthesia with like lidocaine or similar anesthetics, and provide an oral sedative potentially as well, such as Valium or Ambien. But it's not common to get like a general anesthetic or even IV sedation for the entirety of a hair transplant.
I got to the operation room and was prepared for the first part of the procedure, the extraction phase. It began with the
It's also possible to start with the recipient site making first. I've actually transitioned over to doing a lot more of recipient sites first rather than the donor extraction first. I find that that's a more accurate way to do FUE, because by the time you're ready to go to the donor area to do the complete extraction, you know how many grafts you need because you've already made the majority of the sites at the recipient area.
Most unpleasant part of the operation, the local anesthesia. Yes, it was painful, but far from what I expected.
One way to diminish the pain with local anesthetic is to, first of all, deliver it slowly. Another way is to use like a vibration type of tool, because that can trick the brain in part to thinking that it's more of a vibration type of sensation rather than the sensation of pain. And it's also how you create the mixture of anesthetic that can make it a little bit easier to tolerate.
In my case, the whole procedure was no longer than 6 hours, including a short lunch break. At the end of the day, I had a funny looking head, but I was happy that it was over.
So hair transplants can take a long time, especially when they're done with care and precision. It can sometimes take 6 hours, I would say, is rather fast for a procedure of this size. It can easily take 8 hours, 10 hours, sometimes up to 12 hours to complete some of these procedures. You don't want to rush with the extraction from the donor and get a ton of transections, because then that will lead to a lot more scars in the back.
One of the most critical phases is aftercare. There are some rules you must be.
Check out our video on post-op hair transplant care. We basically summarize that entire process for you guys in a video.
Aware of. You cannot wash your head for a few days, and you can only sleep lying on your back for like 2 weeks or so. Nothing too difficult. In addition, you cannot wear hats in the first month, and the hardest thing for me, you can't.
Yeah, there's a lot of big statements here, and I wouldn't agree with all of that. So again, watch our video, and it covers when you can wear hats and how you should sleep and all these different elements. I would say overall we're less restrictive than some of the statements that he just made.
It also wasn't necessary to take long-time medication.
Yeah, I would disagree with that. So he's showing the finasteride box, and he's saying that it was not necessary to take long-term medication. Again, I think maybe he is misinformed here, because the transplant is fine for augmenting that area in the front where he had already lost a significant amount of hair. However, it's not that because he had a transplant that somehow negates the need for medical therapy. That is not true. And when it comes to medical therapy for hair loss, we have a website called feelconfident.com where we essentially provide these prescriptions at very low cost for people who want them. Make sure to go and check it out.
Still, my hair began to grow again. After a few months, it was already clear that it will look much better than before. And after 6 months, I was happy with the new look, even as it was.
Yeah, at 6 months, usually people see about 60% of their final result. After 10 months, it's closer to about 90%. And it takes a solid 12 months to 16 months to see the final result.
18 months to see the final result.
Yeah, you see in his case, it took 18 months, which is definitely possible.
And I must begin by saying, yes, I'm very, very satisfied with the result. I'm very content that I went to Istanbul and that I have chosen.
What people oftentimes don't realize is that one transplant is not enough in bare scalp to create the same density as the original hair. Oftentimes you need a touch-up procedure to bump up that density. That doesn't mean it's a failed procedure initially. It just means that, it's very difficult with surgery to reach original density when you have no hair left in an area.
Their products.
Overall, he had a nice result. But again, that frontal scalp density is not the same as, say, the hair here in that parietal region. And that's normal. That doesn't mean they didn't do a good job. It just means that, he had a single hair transplant. And so if he wanted to bump up the density in that frontal scalp, he would potentially need now a secondary procedure.
The second most asked question was, why can't you tell a big difference between how I looked before the surgery and after? Well, the main reason was because before the surgery I appeared in the videos only with a lot of black sprays, black cosmetics.
So I wish here in the video he would do a nice video before and after, showing him putting his hand, through his hair and really demonstrating the result. That's what I think is lacking even with many clinical websites, where you don't really see like a very standardized before and after, but a nice side-by-side video comparison would really help a lot with visualizing that.
But you may see in the video how large the implanted area was. Yes, you can't tell, especially during my African videos, you can't tell I have implanted hair because
also you don't want people to like really know and have it so obvious that you had like a transplant or you had surgery done. That's sort of the point. You want it to look natural enough where people don't really notice. So that again, I think is more of a testament to the success of the procedure rather than something being so low and so obvious that he had surgery. That's not a mark of success.
So the haircuts didn't do any advantage to me, au contraire, because the implanted hair cannot be as dense as the original one.
Correct. And a lot of people don't realize that. So he's absolutely right in saying that. And it's great that the clinic must have explained that to him. And that's oftentimes a big misconception of a hair transplant, that getting one hair transplant will get you the original density. That's very rarely the case.
There was a suggestion from Dr. Ahmedov that I shall return to Istanbul for a second procedure for making the transplanted area more dense. So not for getting a new hairline lower, but for making the implanted area more dense. Yes, this can be done.
Yeah, some patients ask me, like, let's plan ahead. Let's plan for 2 procedures, 3 procedures. I always tell them it's one surgery at a time. After we see the results of your initial surgery, then we can see what's left in the donor areas, and we can see what the recipient area looks like, and then start to map out potentially a secondary procedure. So it's not something that you need to plan, 2 years in advance. It just you play it by ear. You see what the result is, and then how you can make it potentially even better.
This means from a non-hormonal influenced area grows and the best part is it is not affected by testosterone. This means this newly implanted area the hair from the newly implanted.
The only caveat there is when people do these large FUE harvest procedures, they're usually going into less safe zones when it comes to the donor area, so areas that could thin out over time. And so if that hair was transplanted to the recipient area, that hair can gradually fade as well. And that is yet another reason to consider strongly medical therapy, because you want to preserve that donor area and keep it as strong as possible for years to come.
They recommend finasteride, and this was another question regarding medication and finasteride in particular. Finasteride is recommended for the bald area not to go farther, so the not transplanted hair for not to fall, and in time for not to have a separation area between the transplanted area and the not transplanted area.
Correct, but again, the only caveat there is that it could be beneficial for the transplanted hair as well, as I just stated.
My biggest fears were not about the success of the transplant, were about the pain, and the pain endured during the surgery was not.
I would say that most of the patients who come to me have the fear of it not looking natural, much more so than the fear of pain. But you know, everyone's different. Everyone has different concerns.
Not even a quarter of what I have expected.
I'm glad this gentleman had a nice result from his hair transplant and that he thought overall it was a good experience. I'm always really pleased to see journeys and stories like this, as opposed to, you know, horror stories that always worries me and makes me less happy. But cases like these are great to see. If you want more information on medical therapy for hair loss, make sure to check out this video that we did covering the topic.